What if I told you that the egg sitting in your refrigerator right now, the one you stopped eating for breakfast years ago because your doctor mentioned cholesterol, because a headline frightened you, because somewhere along the way eggs became the food that heart-conscious seniors were supposed to avoid, is not your enemy? What if the decades-long war on dietary cholesterol was based on an incomplete understanding of how cholesterol actually works in the human body? And what if the seniors who gave up eggs in the name of heart health have been missing one of the most nutrient-dense, cardiovascular supportive foods available to the aging body, based on advice that the research has since moved significantly beyond? I understand the skepticism. You are probably thinking, Dr. Griffin, my cardiologist told me to watch my cholesterol. Eggs are high in cholesterol. That seems straightforward. Or perhaps you have been avoiding eggs for so long that the avoidance has simply become habit, no longer questioned, no longer examined, just a permanent fixture in how you think about eating for your heart. You order egg whites at the diner. You read the label on the cholesterol-free egg substitute. You have been careful. And you have assumed that careful was the same as correct. Stay with me, because what I am about to share has genuinely changed how hundreds of my patients eat, and what it has done for their cardiovascular markers has surprised every single one of them. My name is Dr. Raymond Griffin. I have spent 25 years practicing internal medicine with a focus on cardiovascular health and metabolic function in older adults. And in that time, the egg has been one of the most consistently misrepresented foods in the dietary conversation around senior heart health. Not because the science was unclear, but because the translation of that science from research into the advice that reaches actual patients in actual appointments has lagged so significantly behind the evidence that millions of seniors are still operating on. Nutritional guidance that the research community moved past more than a decade ago. These are real people I am talking about. Men and women in their 60s, 70s, and 80s who came into my office with excellent dietary intentions and genuinely confused cholesterol panels. People who had eliminated eggs, reduced saturated fat, switched to margarine, and done everything the old guidance prescribed. And whose LDL numbers, whose inflammation markers, whose overall cardiovascular risk profiles were not reflecting the improvement their discipline deserved. They had done everything they were told. They had avoided the foods they were warned about. They had read the labels and made the substitutions and followed the recommendations faithfully. And they were tired not of trying, but of trying correctly and still not getting the results they had been promised. They deserved a more complete conversation. Today I am going to give you that conversation. How seniors should actually eat eggs to support heart health and lower cholesterol, and why the answer is more specific, more nuanced, and more encouraging than anything you have been told before. Let me explain what is actually happening inside your body with cholesterol. Because the conversation most seniors have been given about cholesterol and dietary fat is not wrong exactly, it is incomplete. And that incompleteness has been generating dietary decisions that are, in many cases, working against the very cardiovascular outcomes they were designed to protect. Most seniors understand cholesterol as a single thing, a number on a lab report that should be as low as possible, a substance found in certain foods that raises that number when consumed, and a reason to avoid eggs, shrimp, red meat, and anything else that carries a significant cholesterol load. That understanding is approximately 30 years out of date. Here is what is actually happening. Cholesterol is not a poison. It is an essential structural compound that your body produces in significant quantities, regardless of how much you consume from food, because it needs it. Every cell membrane in your body contains cholesterol. Every steroid hormone your body produces, including cortisol, estrogen, testosterone, and vitamin D, is synthesized from cholesterol. Your brain is approximately 25% cholesterol by dry weight. Without adequate cholesterol, fundamental biological processes fail. Your liver produces approximately 75 to 80% of your body's total cholesterol supply independently of dietary intake. The remaining 20 to 25% comes from food. And here is the mechanism that the original dietary cholesterol guidelines failed to fully account for. When dietary cholesterol intake increases, the liver responds by reducing its own production proportionally. The system is self-regulating. For the majority of people, eating more dietary cholesterol does not meaningfully raise total blood cholesterol because the liver compensates by producing less. The research that established eggs as cardiovascular villains was based primarily on studies that conflated dietary cholesterol with saturated fat, two different compounds that frequently appear together in food but produce different effects in the body. Eggs are high in dietary cholesterol but relatively low in saturated fat. And it is saturated fat, not dietary cholesterol, that most consistently drives the LDL elevation associated with cardiovascular risk. After 60, two additional changes make this distinction even more critical. First, the aging liver becomes less efficient at regulating cholesterol synthesis, making dietary quality more impactful than at younger ages. Second, chronic inflammation, which increases significantly after 60, becomes a more powerful driver of cardiovascular risk than total cholesterol alone. Understanding these mechanisms changes everything about how you think about eggs, and everything about how you should be eating them. So now that you understand what cholesterol actually is, how the liver self-regulates its production, and why the distinction between dietary cholesterol and saturated fat changes everything, about how eggs should be evaluated for cardiovascular health, the next question is the one that actually matters in practice. What is the mistake? The specific, consistent, repeated error that keeps seniors either avoiding eggs entirely and missing their considerable cardiovascular benefits, or eating them in ways that genuinely do undermine heart health? Here is the mistake, and I want you to hear this precisely. The mistake is not eating eggs, and it is not avoiding eggs. The mistake is eating eggs without a method. The cardiovascular impact of an egg is not determined by the egg. It is determined by everything surrounding the egg: what it is cooked in, what it is cooked with, what it is eaten alongside, what time of day it is consumed, and what the overall dietary pattern looks like in the hours before and after it appears on the plate. A whole egg fried in butter, served alongside processed breakfast meat, white toast, and sweetened orange juice, eaten by a sedentary senior with unmanaged blood pressure, that is a cardiovascular conversation worth having carefully. A whole egg poached or soft-boiled, served alongside leafy greens, avocado, and whole grain toast, eaten as part of a Mediterranean pattern diet by an active senior with well-managed metabolic markers, that is an entirely different cardiovascular conversation. Same egg, completely different context, completely different outcome. The research consistently supports this distinction, and yet the dietary guidance most seniors received collapsed that distinction, entirely condemning the egg for what surrounded it, rather than evaluating it honestly on its own considerable merits. After 25 years of watching seniors navigate nutritional confusion around one of the most nutrient-dense foods available to the aging body, I developed a specific framework for how eggs should be incorporated into a senior cardiovascular diet, a method that preserves every benefit the egg genuinely offers, while systematically eliminating the contextual factors that legitimately undermine those benefits. I call it the EGG method, simple enough to remember, specific enough to actually work. E, eat the whole egg, not just the white. The yolk contains the majority of the egg's cardiovascular protective nutrients: choline, lutein, zeaxanthin, and vitamin D, and eliminating it removes the very components that make eggs genuinely valuable for the aging heart and brain. G, guard the cooking environment. The oil, the fat, and the cooking methods surrounding the egg determine its cardiovascular impact more than the egg itself. This single variable changes everything. G, guard the plate context. What surrounds the egg on the plate either amplifies its cardiovascular benefits or systematically undermines them. The egg does not exist in isolation. It exists in a dietary context, and that context is the conversation most seniors have never been given. 3 principles, 1 framework, a fundamentally honest approach to one of the most misrepresented foods in senior nutrition. Let me walk you through the EGG method exactly as I teach it to my patients, not in broad principles, in specific, practical, grocery store level detail that makes the difference between an egg that supports your cardiovascular health and one that quietly works against it. Step 1. Eat the whole egg. The egg white contains protein. That is its primary contribution. The egg yolk contains protein plus choline, lutein, zeaxanthin, vitamin D, vitamin B12, selenium, and omega, 3 fatty acids, a nutritional profile that is, gram for gram, among the most cardiovascularly relevant available to seniors in a single whole food. Choline specifically deserves attention. It is essential for cell membrane integrity, for neurotransmitter production, and for a metabolic process called methylation that directly regulates homocysteine levels in the blood. Elevated homocysteine is one of the most powerful independent predictors of cardiovascular risk in older adults, and dietary choline is one of the most effective natural regulators of that marker. The egg yolk is the single richest dietary source of choline available. Discarding it in the name of heart health is, from a cardiovascular standpoint, precisely backwards. My specific recommendation: 2 whole eggs, 3 to 4 times per week for most seniors. Not egg whites, not egg substitutes, whole eggs. If your physician has identified you as a hyper-responder, the approximately 25% of the population whose LDL rises meaningfully in response to dietary cholesterol, this recommendation requires individual modification. For the remaining 75%, whole eggs at this frequency produce no clinically significant LDL elevation and deliver substantial nutritional benefit. Step 2. Guard the cooking environment. This is the variable that matters most and receives the least attention. Cook eggs in extra virgin olive oil or avocado oil exclusively. Both are rich in monounsaturated fats that actively support HDL production and reduce inflammatory markers in the cardiovascular system. Avoid butter used in large quantities and eliminate processed cooking sprays containing refined seed oils, corn, soybean, sunflower, which promote the exact neuroinflammation and oxidative stress that eggs themselves, properly prepared, help to counter. Poached, soft-boiled, or lightly pan-cooked in olive oil. These methods preserve the yolk's nutritional integrity while eliminating the saturated fat load that legitimately does influence cardiovascular markers. Step 3. Guard the plate context. Pair eggs with leafy greens, avocado, tomatoes, or whole grain toast at every serving. These companions provide soluble fiber which actively binds dietary cholesterol in the digestive tract and reduces its absorption in plant sterols that further support healthy lipid balance. Never pair eggs habitually with processed breakfast meats, refined white carbohydrates, or sweetened beverages. Those companions are doing the cardiovascular damage that eggs have been incorrectly blamed for. The egg is not the problem. The plate is the conversation. Let me tell you about Clarence. Clarence was 74 years old when he first came to see me. He was a retired architect, a precise, detail-oriented man who had applied the same methodical discipline to his health that he had once applied to building designs. He arrived with a folder. Inside it were 12 years of consecutive annual blood work results, organized chronologically, with handwritten notes in the margins tracking dietary changes he had made in response to each year's numbers. He had been managing his cholesterol with extraordinary dedication for over a decade. He had eliminated eggs completely, not reduced them, eliminated them after a conversation with a previous physician 11 years earlier. He had switched to egg white omelets. He had replaced butter with margarine. He had reduced red meat, increased fish, and followed every piece of standard dietary cholesterol guidance he had ever been given with a consistency that most patients never achieve. He slid the folder across my desk and pointed to his LDL trajectory over 12 years of careful compliance. It had barely moved. His total cholesterol had remained stubbornly elevated despite 11 years of egg avoidance and conscientious dietary modification. His HDL, the protective cholesterol, had actually declined over the same period. And his inflammatory markers, which I added to his panel at our first visit, came back significantly elevated, a finding that none of his previous annual panels had ever measured or addressed. When I walked through his daily dietary pattern, the picture became immediately clear. Clarence had eliminated the egg and replaced it with processed egg white products containing additives, refined breakfast cereals marketed as heart-healthy, and margarine containing partially hydrogenated oils. He had made 11 years of careful substitutions that had systematically removed one of his best available sources of choline, vitamin D, and anti-inflammatory omega, 3 fatty acids, and replaced them with processed alternatives that were quietly driving the inflammation. His cholesterol numbers alone had never revealed. He had been given the wrong target, and he had hit it perfectly for 11 years. We introduced the EGG method together: 2 whole eggs 4 times per week, poached or cooked in olive oil, leafy greens and avocado at every egg meal. Processed egg substitutes and margarine eliminated entirely. At his 6-month follow-up, his HDL had risen 14 points. His inflammatory markers had dropped significantly. And for the first time in 11 years, his cardiovascular panel was moving in the right direction. He looked at me across the desk and said, 11 years. I gave up eggs for 11 years. Now I want to talk to you honestly about what to expect. Because Clarence's HDL rose 14 points at 6 months, and I do not want you to abandon the EGG method at week 4, because your numbers have not yet moved as dramatically as you were hoping. Cholesterol panels respond to dietary change more slowly than most patients expect. And the specific markers that the EGG method most powerfully influences HDL, inflammatory markers, and homocysteine respond on a timeline that requires patience and consistency before the full picture becomes visible in your blood work. So here is the real timeline, honest and specific. In the first 2 to 3 weeks, the most important changes are not yet measurable on a lab panel. They are happening at the cellular level in membrane integrity, in choline availability for methylation, in the gradual reduction of the oxidative stress generated by the processed substitutes the EGG method eliminates. You will not see these changes in a blood test yet, but they are the foundation that the measurable improvements are built upon. Do not judge the method by what a lab panel shows at 3 weeks. By weeks 4 to 6, most of my patients begin reporting something specific and consistent. Energy levels improve. Mental clarity sharpens a direct reflection of improved choline availability for neurotransmitter production and cell membrane function. These are not cardiovascular markers on a lab panel, but they are real physiological signals that the nutritional environment inside the body is shifting in the right direction. By months 2 to 3, lipid panels begin reflecting the dietary change meaningfully. HDL, the protective cholesterol, typically shows the earliest measurable movement, rising gradually as the monounsaturated fat from olive oil and avocado supports its production. Inflammatory markers, if your physician is measuring them, begin declining. Homocysteine levels, if elevated at baseline, begin responding to improved choline intake. By months 4 to 6, the full cardiovascular impact of the EGG method becomes visible in a comprehensive lipid and inflammatory panel, as Clarence discovered at his 6-month follow-up. Now, let me be absolutely clear, and I mean this as genuine medical guidance, not a legal formality. The EGG method is not appropriate for every senior without individual evaluation. If you have been identified as a dietary cholesterol hyperresponder, if you are managing familial hypercholesterolemia, or if your physician has given you specific individualized dietary restrictions, please discuss any dietary changes with your doctor before implementing them, including this one. This framework applies to the majority. Your physician determines whether you are in that majority. I want to challenge you personally, not with a vague suggestion to reconsider your breakfast routine. A specific, concrete, 30-day challenge with a defined dietary commitment, a clear measurement framework, and an honest way to evaluate whether the EGG method is producing the cardiovascular shift it has produced for Clarence and for hundreds of patients in my practice who arrived at the same conversation carrying the same 11 years of careful, misguided egg avoidance. Here is exactly what I am asking you to do. For the next 30 days every day, without exception, follow all 3 steps of the EGG method as I have outlined them. 2 whole eggs, 3 to 4 times per week, cooked in extra virgin olive oil or poached, leafy greens, avocado, or whole grain accompaniment at every egg meal. Processed egg substitutes, margarine, and refined breakfast products eliminated for the full 30 days. On the days you are not eating eggs, I want you to apply the same plate context principle to every meal. Olive oil as your primary cooking fat, leafy greens at a minimum of 2 meals daily, avocado 3 to 4 times per week as a fat source in place of processed alternatives, These are not egg-specific instructions. They are the dietary environment that makes the EGG method work as a complete cardiovascular framework rather than an isolated breakfast change. Before you begin today, before your next meal, write down 3 numbers if you have recent blood work available: your total cholesterol, your HDL, and your LDL. If you do not have recent blood work, schedule a lipid panel this week before beginning the challenge so you have a genuine baseline to compare against at 30 days. At the end of 30 days, request a repeat lipid panel and inflammatory markers, specifically CRP, which measures cardiovascular inflammation from your physician. Compare those numbers to your baseline. In my experience with patients who follow the EGG method consistently for 30 days, HDL begins rising, inflammatory markers begin declining, and the overall cardiovascular picture begins moving in a direction that 11 years of egg white omelets and cholesterol-free substitutes never managed to produce. 30 days, 3 specific daily habits, 2 blood panels. Let the numbers tell the story. And then come back and tell me what happened. If you watch this entire video, go to the comment section right now and type the words egg method, just that. It tells me this conversation reached someone who needed it. I read every single comment on this channel, every one, without exception. This community exists because of the people in those comments, and I take that more seriously than I can express in a closing line. Type EGG method right now, and tell me how long have you been avoiding eggs. I want to know where you are starting from. I want to be honest with you about something. Something that stays with me long after the appointment ends, long after the patient has left, and the next chart is open, and the day has moved on. Something that 25 years of watching seniors navigate nutritional confusion has not made easier to sit with, and I have stopped trying to make it easier. Because the discomfort of it is what keeps me making these videos, instead of assuming the information is already reaching the people who need it. Clarence kept a folder for 12 years. 12 years of meticulous, disciplined, genuinely motivated dietary compliance, organized chronologically, annotated carefully, representing thousands of individual meals, where he made the harder choice because he believed it was protecting his heart. And it wasn't. Not because he wasn't trying, not because he wasn't disciplined, but because the guidance he was given offered in good faith, based on the best understanding available at the time, had not kept pace with what the research was showing. The egg had been convicted on incomplete evidence, and Clarence had been serving the sentence faithfully for 11 years, while the exoneration sat in journals he had no reason to read. He is not unusual. He is, in my experience, representative of an entire generation of seniors who made careful, motivated, sustained dietary sacrifices based on nutritional guidance that the science has significantly revised and who never received the update because nobody scheduled an appointment to deliver it. That gap is why I am here. That gap is why this channel exists. You now have what Clarence needed 11 years before he found my office. The mechanism, the mistake, the method, the timeline, the complete nutritional conversation that his previous appointments never had enough time to deliver. And I want you to do one thing with it, just one thing, not the entire EGG method restructured overnight. One thing. Tomorrow morning, for the first time in however long it has been, cook yourself 2 whole eggs in a teaspoon of extra virgin olive oil, soft, not overcooked. Serve them alongside whatever leafy green is in your refrigerator right now. Spinach, arugula, whatever you have. That is breakfast tomorrow. That is where Clarence's story turned around. Yours can turn around tomorrow morning. Before you close this video, I want to ask you to do something that will take 10 seconds and could genuinely change how someone you love eats breakfast tomorrow morning. Think about the people in your life right now, not abstractly specifically. A spouse who switched to egg white omelets years ago and has never questioned whether that sacrifice was actually producing the cardiovascular benefit it was supposed to. A sibling who reads every nutrition label, avoids every food that carries a cholesterol warning, and whose lipid panel has stubbornly refused to reflect the discipline that deserves better results. A close friend who mentioned recently that their doctor adjusted their cholesterol medication, again despite years of careful dietary compliance that should have been moving those numbers without a prescription change. Nutritional misinformation has a particular cruelty when it targets people who are genuinely trying, who are making real sacrifices. who are ordering the egg white omelet and choosing the cholesterol-free substitute and doing everything the guidance prescribed, and whose cardiovascular panels are not reflecting the improvement that level of dedication deserves. Because the problem was never their discipline. The problem was the target. And a target that has not been updated in 11 years sends motivated, careful, well-intentioned seniors in the wrong direction with absolute consistency. If this video reached you today, if something I said named, something you have been doing, or watching someone you love do, without the results it should be producing, then there is almost certainly someone in your circle who needs this conversation. Share this video on Facebook right now. Not a general share, a direct, deliberate tag. Find the person whose egg white omelet came to mind while you were reading that last paragraph and tag them directly. Tell them you watched this and thought of them. Tell them 30 days and 2 blood panels is all it takes to find out whether the last decade of careful egg avoidance was actually necessary. Tag them now, before you close this video. The conversation they have never been given is 1 share away. And if you want more conversations like this one, the updated science, the complete mechanism, the specific guidance that replaces outdated advice with what the research actually currently supports, I post a new video every single week on this channel. Nutrition, cholesterol, heart health, blood sugar, the dietary conversations that matter most for cardiovascular health after 60. The updates that most appointments never have enough time to deliver, and most patients never know they are missing. This channel exists because the gap between what the research shows and what reaches the patient in a standard appointment is wide enough to cost 11 years of unnecessary egg avoidance. And that gap deserves to be closed, 1 conversation at a time. Subscribe right now, turn on notifications, and bring someone you love along with you, because the more accurately informed the people around you are, the better every meal decision gets made. I'm Dr. Raymond Griffin. Eat well, stay informed, and enjoy your eggs. I'll see you in the next one.